It is always wonderful to see a member of a rank and file Seattle Study Club come to the fore and have something to share with us. I am so happy that we're going to begin that process this morning. You're going to see a whole crowd of people who work together regularly in the collaborative process that has become the hallmark of the Seattle Study Club. We're going to begin this morning with a gorgeous human being, a wonderful clinician, a super collaborative partner with his specialists, Confessions of a Former Single-Tooth Dentist, Dr. Brian Schroder, everyone.
Thank you, Sandy. I've already learned a couple of things this morning. One of them is I'm not getting paid $75,000 for 15 minutes. And how to do this. And the third thing I've learned is I'm not special, so I feel really, really good this morning. Wow. Thank you for the privilege. I appreciate the opportunity to be here. My topic is pretty self-explanatory this morning. I will essentially tell you what my game plan happens to be. In thinking about what I wanted to say to you this morning, I decided that I would make this a story of me, a story of my practice, a story of my professional life. And I thought the best way to do it would be to divide it into a couple of phases. We'll call phase one the me phase of Brian, and we'll call phase two the we phase, okay? And that will become a little bit more apparent and a little bit more clear, my reasoning behind that as we progress through the program. So in order to satisfy my left brain, which I learned yesterday we all have, and it kind of dominates my world, I have some learning objectives and some bullet points to talk with you about. The first one, the learning objective, would be what exactly is a single-tooth dentist. We'll talk about what my definition of it happens to be. And in contrast to that, I would say the next learning objective would be what exactly is an interdisciplinary dentist. The third, why are most of us single-tooth dentists? The fourth would be, is it okay? I mean, are we all right being single-tooth dentists or not? Is there a problem with that? The fifth would be what obstacles stand in our way of becoming interdisciplinary dentists should we choose to do so. If it's something that you want to do, what obstacles are out there that prevent us from becoming interdisciplinary dentists? And if those obstacles exist and we can identify them, how can we overcome the obstacles that are present in front of us? And finally, I'd like to make my last learning objective be what are the benefits of providing interdisciplinary care. Hopefully at the end of the program, you'll see that there's been some benefits to me in providing interdisciplinary care. So that kind of satisfies my left brain needs and requirements for you this morning. Let me move to the right brain for just a brief period. This is a little place in the hill country of Texas that my wife and I are privileged to own. We get to call it home most weekends, not every day of the week. But it's about an hour north of San Antonio in an area of Fredericksburg. And some of you have heard this story before, but indulge me and listen to it again. In order to get there, you have to travel some old country roads. And when I'm traveling down the old country road one Saturday morning, I happen to glance over, and out of the corner of my eye, I see the sign that says, "Talking dog for sale." And I thought, wow, that's kind of interesting, and it's really kind of outside my character, but I had time on my hands that morning, and so I decided I'd turn around and go back and find out what it was all about. So I pulled into this old German farmhouse, and I knocked on the door, and this old man came to the door, and rather sheepishly, I looked at him and I said, "So you have a talking dog for sale?" And he looks at me and he says, "Yeah, I do." And I was shocked. I kind of looked around for cameras to make sure I wasn't on camera, candid camera. And he said, "He's around back." I said, "Cool." So I walked around the back of his house, and there sits this old dog. So again, looking for cameras and making sure that I wasn't being taped, I look down at the dog and I say, "So you talk?" And he looks up at me and he says, "Yep." I gathered myself a little bit. I said, "So tell me your story." And so this dog proceeds to tell me that when he was young as a puppy and they found out that he could talk and understand, they hired him into the CIA. And as a member of the CIA, he was transported over to Europe, and he was an operative with all of the spies in Europe, and he traveled around and got a whole bunch of information for the CIA in Europe because nobody thought a dog could talk and could relay information to people. And when 9/11 happened, he said, they brought me back to the United States to head up the Canine Division of the Department of Homeland Security. And I set up all these stings all around the United States at airports and stuff. And, you know, it was a really busy job. I was really at it for quite a while. And he said, you know, people years are a lot longer than dog years. I mean, we get older faster than you do. So it was about retirement time, so I just decided to come to this beautiful place and kind of sit out here and live large. I thought, wow, it's pretty incredible. So I told the dog goodbye. I walked back around to the front and I knocked on the door and I asked the man, he came to the door again, I said, you know, that's the most incredible dog I've ever seen in my life. I said, I got to have him. How much do you want for that dog? And he looks at me and he said, $10. I said, $10? How can you possibly just want $10 for a dog like that? He said, because he's a liar. He's never been out of the yard. Your laughter does a lot for me. It kind of helps me in this presentation, and it helps you kind of engage with me this morning. So I appreciate that. Obviously, that's a rather fictitious story. What exactly is a single-tooth dentist? Well, I'm going to define it as a dentist who plans and performs only single procedures. If a patient comes into my office and they have a broken tooth, I can recommend a crown for it. If they come into my office and they have decay, I can put a restoration on it. If they come into my office and they have a toothache and they need endodontic therapy, then I can provide that therapy for them. But basically, it's a focus of practice that's essentially looking at individual procedures in order to fill time slots in my schedule, in order to make me busy enough so that I make enough revenue in order to make my world turn. All right? So is everybody with me on that? We agree that that's a pretty accurate description of a single-tooth dentist. In contrast to that, what would an interdisciplinary dentist be? Well, after a few years of kind of going through this, I've determined that an interdisciplinary dentist, to me, would be defined as a dentist who provides comprehensive care in concert with his or her colleagues. And I put in concert with his or her colleagues to try to distinguish that term from multidisciplinary dentistry. I think that it's important that we note that all of us work together. I won't say but our interdisciplinary team works together communicating diagnostic information, patient biographic information, everything that we need to know in order to help arrive at the best outcome for our patient. We communicate together. We don't do it separately. So that would be my definition of an interdisciplinary dentist. I asked a couple of my friends, and you'll hear from them this morning later, exactly what makes a case interdisciplinary, and what they told me was this. They said when the gingival architecture or the frame meaning primarily the lips, are wrong, it becomes an interdisciplinary case. So if a lady like Allison comes into your office and she says, hey, Dr. Schroder, I'm kind of not liking the way my front teeth look anymore. They're getting worn, they're getting short, they're kind of brown. I want to look better. Can I do that by myself? I would suggest to you that the frame is great. But I would suggest to you that the gingival architecture is wrong, and as a consequence, I can't use a handpiece or restorative material in order to be able to correct Allison's problem. So I think it very quickly becomes an interdisciplinary case, not a single tooth case, okay? So obviously Allison has some gingival architecture issues that are problematic for us, and we need other people involved in it. Why are most of us single tooth dentists? What images come to mind? What reasons come to your mind that most of us would be a single-tooth dentist? I think there's multiple reasons for it, but in thinking about it, I thought there's a couple of them that stand out. One of them is that our education taught us how to do this, okay? When you're in dental school, what do they teach you? Individual procedures. Operative dentistry teaches you how to cut amalgam preparations and restore amalgams. Periodontics teaches how to do scaling and root planing. Endodontics teaches how to do access preparations. And logistically within the school, you can't really get the bigger picture of interdisciplinary care. Logistics are a problem. Time is a problem. The complexity of case selection is a problem. Not to mention the fact that most of the faculty members in our general dental programs and dental schools aren't fluent in interdisciplinary care either. They don't have an interdisciplinary team to work with. So I think really and truly that our education started a problem. The second area that I think is a problem in this, as far as why we're single-tooth dentists, is this. How many of you in the audience have not had a patient say to you, "Doctor, what does my insurance cover?" I dare say every single one of us, right? Well, we've become this insurance-dependent society. And I think it's because of the medical model of insurance. We all believe that we have this privilege of a certain level of health care because of our medical insurance. Well, picture if the medical insurance model had the dental insurance model. So Michael Cohen goes in and he needs stents done in 2 arteries. And he says to the doctor, "Well, how much does my insurance company pay?" And the doctor said, "Well, they'll cover 1 stent this year, and then you can come back to us next year and you can get that second stent done." And the doctor says, "Well, what if we kind of put you to sleep at 10 o'clock on New Year's Eve and we get the first stent done on New Year's Eve, and then we put you, we keep you asleep and we do this?" The whole thing is preposterous, right? Well, we got to get past this dental insurance model as being the driver of care. So insurance plans obviously have something to do with it. Don't hear me say that being a single-tooth dentist is a bad thing, okay? Single-tooth dentists can be outstanding at what they do. We can be excellent. This is Lynn. Lynn needs to have some crowns redone on teeth number 7 and 10. Those are the old porcelain bonded to metal restorations that are on her teeth. And after changing those restorations out, she ends up with some all-ceramic restorations on her lateral incisors that I think, I'm proud to show you, are great representations of what single-tooth dentistry can do. If you look at Judy, Judy has a greater desire for higher quality dentistry. She's actually the wife of one of the dental school deans. And she says to me, "Whatever you would do for you or your wife, I'd like to have done." Well, I have the ability then to go in and do some cast gold preparations. And I can do cast gold restorations on those teeth that look, I think, exceedingly good. So I can be a very, very good single-tooth dentist. All of you can be exceedingly good single-tooth dentists. It is not a bad thing to be. As we were just talking about, is it okay to be a single-tooth dentist? I think absolutely. It's perfectly okay to be a single-tooth dentist provided you're happy and professionally satisfied. And that's great. That's okay. But I have one question that I would like to ask you, and this has been kind of an epiphany for me over the course of the last few years. And that question is this. Do your patients believe you're providing comprehensive care? Or have you taken that privilege away from them? I think that we as professionals need to make sure that we provide our patients all of the options that are available to them in dentistry, and we give them the privilege of choosing. And sometimes if I get into the habit of providing single-tooth dental care, I take that privilege away from my patient, and consequently, I think that's wrong, okay? So yes, it's great to be a single-tooth dentist if that's how you choose to practice. That's wonderful, but give your patients the privilege of making a choice. So what's my story? My story is I graduated from dental school in 1982. I did a general practice residency at the Veterans Administration Hospital from 82 to 83. And in that residency program, I was taught oral surgery by oral surgeons. I was taught periodontics by a periodontist. I was taught endodontics by an endodontist, prosthodontics by a removable pros guy. It was all specially driven. So I left that program and I thought, man, I pretty much know how to do this, all right? I got it figured out. So when I leave the residency program and I start in private practice, I'm thinking I can do it by myself. The me phase of dentistry is here, okay? And I started practice part-time. I'm teaching part-time at the dental school. And one of my patients that was in my practice at the time was Lydia. So here's what we're going to do. We're going to go through Lydia's case before interdisciplinary care and after, and let me introduce you to her. And I'm not going to spend a whole lot of time discussing what you see in these next photographs. I'll let all of you who are interdisciplinary trained dentists make some observations. But this is a patient who's been coming to see me every 6 months. She gets her teeth cleaned. We have made an interocclusal splint or two for Lydia, and she's broken a tooth here and there. And you'll look and you'll see that I have done some cast gold restorations in the posterior to protect the other teeth from protect the teeth from breaking. We've done some metal occlusal porcelain bonded to metal crowns. I did not do the 3-unit the fixed partial denture replacing number 6, but I wouldn't tell you that I wouldn't have done it had the situation not presented itself. Here's a mandibular occlusal view. I did those crowns on the molars. Here's a confession for you. I referred her to the periodontist because she had some great big tori and exostoses, which prevented her from being able to floss her teeth. That's how single-tooth dentist I was. So I referred her to my periodontist colleague because of those tori and because of those exostoses and an inability to take care of herself. The right buccal view, you can see that we'd done some nice 7/8 gold restorations. The left buccal view, okay? So that's Lydia 15 years into the game with Brian. And we've had a great relationship. She's wonderful. She's happy. She likes me. She likes the team. She likes everything about us, okay? What obstacles stand in the way? You know, basically at that point in my career, the me thing was not doing it for me anymore, all right? I come to work, I do the same thing over and over again. I basically do it by myself and I go home. I do it with the same people, and we're all kind of in that rut, okay? So I got to do something different that makes dentistry more challenging, more exciting, more stimulating. It just makes it better for me. And one of the things, so what obstacles keep me from doing that? Well, this we could pretty much talk a whole day about. But I think the business model that we practice in dentistry is horribly flawed. It's antiquated, it's expensive, logistically it's burdensome. When you think about how we've evolved from barbers, and we have our little single private practices all around the community, and we actually try to get as far away from each other as we possibly can because we don't want to try to compete for patients with everybody, so we're spread across the city and the municipality. Well, I think that does several things that are against us, negative to us. Number one, it prevents us developing the relationships that we need in order to provide better care for our patients. It prevents that relationship building and development. And the other thing that I think that it does is it's not a good business model as far as economies of scale are concerned, and it doesn't enable us to collaborate and get our brains together and make the patient better, make the patient outcomes better. So I think one of the principal obstacles, besides our education, besides insurance plans, is that the business model of dentistry needs to be changed. So assuming I've made the decision that I want to change this business model, I want to change, you know, my practice type and my practice style, what avenues are available for me to do that? Well, I think that if education is the biggest part of the problem, then we need to seek education outside of dental schools, right? And maybe not education in the sense of go to the Texas Dental Association meeting and pick and choose a teacher or a course to take every now and then. I'm talking about something where we learn together. And obviously, the reason for this program is because joining a study club is what I'm going to suggest is a great way to do it. If you ask why you're a member, okay, ask yourself why you're a member. What would that be? It's going to be different for all of us. It might be the collegiality, it might be the socialization, it might be the continuing education. There's a multitude of reasons why we're members of this study club. Excuse me. Water helps and water hurts. But if you ask our illustrious leader, and you know Michael, he's kind of a behind-the-scenes kind of guy, and he's not about telling people about his accomplishments and stuff. We heard yesterday about his heart problem. Let me tell you that in October, Michael was inducted into the Fellowship of the American College of Dentists. To tell you how small the world is, I was inducted as well, and we're processing in, and I'm walking in to take my spot, and there's this man standing there, and he looks at me, and I look at him, and he looks at me, and mind you, he looks like that. He's got that hat on. And he goes, "Brian?" And I said, "Michael?" And it was Michael right in front of me in this ACD induction ceremony. So, and obviously that's Clyde Umaki, who's his sponsor. And Bill was in Hawaii doing Clyde's presentation for Clyde's study club that day. So anyway, we're everywhere, Seattle Study Clubbers. Michael says in Inside Dentistry that traditionally a study club has been viewed as a group of individuals who meet on a regular basis to better their understanding of the art and science of dentistry. He goes further to say that the theory behind this conventional model of learning would appear to be the notion that knowledge of a technique or treatment is created through visual and verbal description. So I can show you pictures, I may show you videos, I can talk about something, and I can make you understand it, and I can make you learn it. So Michael goes on to say finally that the core and essence of the Seattle Study Club programming is interdisciplinary comprehensive treatment planning. All right? Totally agreed. Well, I've had the privilege of talking to some of your clubs for the last 3 years. As you might know, I was on the speaker showcase in 2010 talking about digital replication and digital impressioning. And as a result of that, I was able to come to some of your clubs. And in conversation with some of the directors, some of you directors, it seems like a common theme has been that regardless of the amount of education that you provide for your membership, it doesn't necessarily result in a change in behavior as far as treatment is concerned. And so with all due respect to Michael, I'd like to add my little clip here, which is that I believe the core and essence is interdisciplinary comprehensive treatment, not just planning. And I'm here to encourage you to participate in the treatment portion of it, not necessarily just the planning portion of it, okay? So that's, I think, what we're about. When you look at the clinical program, I went back and looked for the last 8 or 9 years at the dentists that have come to see us in San Antonio. The list is impressive. Some of you are here today. Thank you for coming. I can't possibly talk about all of them, but these are people just in the last 8 years that we've had come and talk to our study club. An enormous amount of clinical information, an enormous amount of clinical knowledge that's been presented to me to carry back to my practice. Doing it can be a challenge, all right? Another thing that serves the purpose of helping me transition is this. The meeting that we're at right now. The symposium is like no other meeting I've ever attended in my life. I was at the Go Western sort of gala last night, and I was talking to a gentleman, and he said, my wife has decided that we're coming to this program every year. And the reason, and he was very sincere to me, he said, the reason is because when I go back home, she says I'm a better person. All right? Why? I believe that the non-clinical program is my greatest benefit from the Seattle Study Club Symposium. These are just a few of the people that I've had the privilege of hearing that have been very impactful in my life, and the non-clinical program is a huge part of it. So I think that Evelyn would probably say that I'm a little bit better person whenever I come back home from this meeting. That was a joke. I'm always a good person. So let's continue my story, okay? My transition to interdisciplinary care, how did it happen? Well, one of the ways that it happened is I found a mentor. Actually, I found more than one. I found 4 of them in a photo booth at my daughter's wedding. That's obviously Eric Rindler on the left. Blois, you heard yesterday talking with Vince. And I would assume that all of you in the audience know who that guy in the front on the right-hand side happens to be. I squeezed my way in. Well, one of these mentors of mine said I needed to photograph cases. Bill's going to talk to you later about global diagnosis. Well, global diagnosis, he's going to tell you that the camera is a more important tool in diagnosis and treatment planning than the articulator is. I've come to learn that. I started taking photographs of cases. Look at Steve. Look at Steve. Photographs are powerful, all right? Obviously, he's got dental problems. And through the power of diagnosis and photography, we actually showed him what those problems were, and ultimately we got Steve taken care of. And it's not the dentistry I want you to notice in this photograph, it's the fact that he grew a whole head of hair after I took care of his teeth. So photographs are a huge part of what I do now. This is another thing that's enormously important. I made a commitment, okay? I made a commitment. What did I make a commitment to do? Well, first of all, I want you to know that I learned when I was working out, because one of my friends told me that working my body helps my mind and helps my attitude. I looked on the wall of Gold's Gym, and it says, know that commitment is a muscle. It needs to be worked out just like all the rest of the muscles that we have. Well, the study club, this whole environment right now, you guys are working my commitment muscle overtime, okay? Commitment is a key to the thing. So what did I commit to do? There's 3 things that I'd like to share with you that I made a commitment to do. One of them is to commit to lead. I realized, I came to the realization that the person that was going to be responsible for this change was looking in the mirror at me every single morning and every single day. If I look in the mirror, it's me, okay? So I made a commitment to change, to lead. And as a student of leadership, I read a lot of books. I mean, some people sit on the beach and read 50 Shades of Grey. I sit on the beach and I read stuff like John Maxwell, who's a phenomenal author on leadership. I've read all these books of his. I would recommend him to anybody who wants to be a student of leadership. But the one book that I would recommend to you is this one. It's called the Maxwell Daily Reader. It's 365 days broken up into this book, and it takes about 5 minutes to read each one of these snippets, and it's either in the evening before I go to bed or in the morning when I awake and I read one of these in order to help me maintain that commitment, okay? So a student of leadership. The other thing that I made a commitment to do is to grow. Now, it's obvious that some of us have made a greater commitment than others. I love Bill Robbins. He's one of my heroes in dentistry, and he's such a good sport. He just lets me do this to him. No, not that kind of growth. I'm talking about personal and professional, spiritual type growth. And if you take anything away from this presentation today, I want you to take this. John Wooden. Anybody remember who John Wooden is? John Wooden was a basketball coach, coached UCLA to an enormous number of wins. His legacy as a basketball coach pales in comparison to his legacy that he left behind as far as books that he's written, authorship. I would recommend this one to you. For those study clubs that I've had a chance and the privilege of talking to, I typically take this as my handout instead of a handout. So, and I've had a lot of feedback from people that I've given this book to, and I would get it, and I would read it, and I would share it with my family. It's a phenomenal book. And also, as a student of growth, I would suggest that Shawn Acker is a good guy to read. And I'm not going to steal his thunder. When I put this program together, I wasn't aware that he was on the podium on Friday. But Shawn is an amazing speaker, and he's a positive psychologist. The gist of his message is that success does not create happiness. Happiness enables success, okay? So he says we have it backwards. I'll let him tell you the story. And the final thing that I committed to was to change. Change. And the author that I read that I think helped me a lot was a guy named John Gordon. And John Gordon wrote these books. It's called The Energy Bus, The No Complaining Rule. There's a whole bunch of them. And he writes them in fable, easy reading style. In fact, what I've done is I've taken these books and I've actually provided them to my team, and we read them together. The one that I would recommend to you is called The Energy Bus. And the Energy Bus points the finger right at you, okay? You're the driver of your bus. You can invite people on, or you can also invite people off. It's important to note that change can be a very stressful thing. It's disruptive. Why are we so reluctant to change? Because it's disruptive. It creates problems in our lives, and it's much easier to stay where I'm happy, to stay where I'm comfortable. You have to resist.